Welcome to another episode of Notable Perspectives. I'm your host, Dr. Muthu Alagappan, and today we have a very special guest joining us, Dr. Toby Cosgrove. Dr. Toby Cosgrove is the former president and CEO of the Cleveland Clinic and currently serves as an executive advisor to a select group of companies in the healthcare industry, including Notable, for which we are very grateful. Toby is an acclaimed cardiothoracic surgeon by training. He started at the Cleveland Clinic in the mid-1970s, and in 1989 was appointed as the chairman of the Department of Thoracic and Cardiovascular Surgery. He served as the president and CEO of the Cleveland Clinic from 2004 to 2017, and during his tenure, the Cleveland Clinic more than doubled its revenue and expanded locally, nationally, and internationally, becoming Ohio's largest employer. Toby is the recipient of numerous awards and is regularly quoted by the press in newspapers like the New York Times and the Washington Post. He has appeared on broadcast news networks including CNN, Fox, MSNBC, NBC, and CBS, and is ranked among modern healthcare's 100 most powerful people in healthcare. Toby, thank you so much for joining us today on the podcast.
Well, it's a pleasure. I'm looking forward to it.
You've had just a tremendous and illustrious career, but I'd like to start sort of at the beginning of your professional career. What drew you into healthcare and becoming a physician?
Well, actually, it started very early when my dream was born. I lived next to the chief of general surgery at George Washington, and he had in his boathouse pictures of the operating room, and I thought I'd look great in a mask. So at 10 years old, I decided I wanted to be a surgeon.
That's fantastic. And the mask and the cap, it is quite the look.
It's a great look.
So you entered the field of cardiothoracic surgery and sort of have been a surgeon in the field during a time of immense progress, both in surgical process and medical device and techniques. What was that like, living through and working through such great progress in the field?
Oh, it was fantastic when I look back on it. The things were moving very fast. During the time that transplant came along, coronary bypass surgery came along, valve repairs came along, aortic aneurysms got much more sophisticated. Congenital heart surgery really grew into a specialty. And it was just a very exciting time that changed and gave you an opportunity to innovate and change with it.
So when I was in medical school, it was sort of assumed that these things were possible. But, from your perspective, for any one of these procedures, did you ever think, this isn't possible and sort of you were proven wrong as you saw it come to life?
Absolutely. Well, when I was initially at Boston Children's Hospital as a medical student, in one day we lost 5 kids. And, and by the time I came back as chief resident at Boston Children's Hospital in 1975, we were operating on newborns and doing complete repairs of tetralogy of Fallot, and by deep hypothermia and stopping the heart. And this was unimaginable when I was a medical student, and it just kept getting better over time.
Wow, that's incredible. You mentioned, being there when you lost 5 kids on one day. You can imagine that's incredibly tough. And now we're at a point, I think I've heard you say before, that mortality rates now are so low and can be, surgeries can be done so safely. So it is incredible to look back and see how far we've come.
It's amazing and very exciting. And things are continuing even better. It's interesting that the first people into almost any disease are surgeons, and then it becomes medical, and then it becomes preventive. And what now we're seeing is the first was coronary bypass, and then it was stents, and now it's prevention, which is dealing with a major cause of death in the world. So it's amazing what we've seen in one person's lifetime.
I like that framework of surgery, medicine, preventive. I think you pointed that out in sort of the cardiovascular space. And we're seeing that in oncology as well, cut it out,
Mm-hmm.
radiate it or kill it and hopefully prevent it. I like that framework. So One question I often like to ask physicians is would you do it all again? Knowing where we are today as a healthcare field, and you hear about burnout and you hear about everything else, would you, if you were a 22-year-old leaving college today, would you become a physician again?
Absolutely. And I think that there's a couple of really good things that are happening. First of all, it's you're doing good and you're getting a reasonable pay for it. And it's nice to be able to go home every day and say, I really helped some people. The second thing is that technology is moving so fast and the new knowledge is coming along. The total amount of knowledge in healthcare is now doubling every 73 days. And so the changes that we're seeing are just astounding. And the future and being part of that future is very exciting opportunity.
I think that's a great perspective. I think it's easy to get sort of discouraged by the press around what medicine has become. But I think what you're pointing out is that we're also living in a time where progress has never been faster. And we're seeing an exponential increase in the pace of innovation. And so thank you for restoring some light into what other people may paint as sort of a much darker picture.
No, I wouldn't have done it any other way. I've had a wonderful time and it's been a privilege.
So we talked a little bit about how you got into the field and sort of cardiothoracic surgery. You've had a very successful career in academic medicine, rising from a trainee, like everyone starts at, to a professor, to the chair of a department, to eventually the CEO of the Cleveland Clinic. But that doesn't truly sort of acknowledge all of the sacrifices you undoubtedly had to make along the way to serve your patients and to serve the system for so many years. I'd love to hear both about your progression from, a recent graduate from a training program all the way to eventually becoming the CEO of the health system, but also to hear about the sacrifices that it perhaps took along the way.
Well, it's interesting. It started way back then. Even before this, I didn't think I was going to get into medical school. It turns out that I applied to 13 medical schools and got into one. My grades in college were terrible. It turns out that I'm dyslexic, which made my academic career not anything but brilliant. And I certainly was, nobody expected me to be a star. In fact, at that time when I came to Cleveland, nobody wanted to come to Cleveland. My friends in Boston had a wake for me when I left because they thought I was driving off the end of the earth. But it turned out that it was a great opportunity because shortly before I got here, they did the first coronary bypass operation in the world. And when I arrived here, 5 of us were doing 3,000 heart operations a year. So instantly, I uh, had an opportunity to operate like crazy. And as they say, you can teach even a monkey to do surgery if they have enough experience. So I had plenty of experience, and that gave me the opportunity to um, write, to travel and talk, to be exposed to other great surgical colleagues. And it was a progression that was exciting almost every day when you went and did it. And, you're doing 2 to 4 heart operations every single day, 5 days a week. Um, and that, you get, so you know what you're doing at that. And you see a lot of things that people who are not doing as much never get to see or never get to figure out. So that was a opportunity. And then as I got a little further along, I got the opportunity to begin to have my own ideas about innovation and wound up developing um, a bunch of devices and getting a bunch of patents, and that exposed me to industry. You stop and think about it. We in medicine really need to partner with industry because all the things that we use every day, whether it's drugs or surgical instruments or anything, somebody else makes. So you can't dream of something and lying in your bathtub and develop it yourself. You have to go and include other people. So that was a very rich experience to get exposed to industry early stage and develop some your own things and get them introduced into the healthcare delivery system, which was also a further step. I never anticipated that my career was going to go this direction. I certainly never prepared myself or anticipated being a cardiac or going to be CEO. I had started a venture capital company for the Cleveland Clinic, and I thought that I would go to California and continue my venture capital business when I was about 64, and thought it was time to hang up my spikes. And the CEO at that time, Floyd Loop, decided to step down, and I was asked to throw my hat in the ring, and that started a whole another career, which I was totally unprepared for, but had a lot of great mentors along the way. So that gave me another perspective on the world of medicine and an opportunity to not look after people just one at a time, but to help an organization mold itself so it look after a lot of people.
Thank you for sharing that. I've observed that many physicians, as their career progresses, they desire that scale of impact, that treating a single patient at a time, as you mentioned, to now being able to make either impactful innovations or decisions that are now affecting large populations in your role as the CEO. I'm curious about that transition and if there's any skills that you learned and perfected as a surgeon that you then found helpful in the boardroom as a CEO making the difficult decisions you had to make.
Well, it's interesting that my predecessor used to say it's easier to teach a doctor business than it is to teach a businessman medicine. And if you look across the healthcare system in the United States, the hospitals that have doctors as CEOs have better quality than do administrative run institutions. And I think that's sort of a validation of his statement. But I had to learn business, and frankly, had no background in business at all. I'd never been to a business school, never even set foot in a business school. In fact, it took me a couple of years to figure out those parentheses and P&Ls. Those aren't good. And but it was the first couple of years were very difficult. But I think the thing that I took away from two things that I took away from my practice. First of all, I had street credibility with the other doctors at the Cleveland Clinic because I'd been there and done that. I had been up all night looking after patients, and I'd gotten called in to look at emergencies, and they know that I'd worked my tail off doing that. So I had some street cred. The second thing is surgeons have to make tough decisions, and you have to make them without full knowledge, and you have to make them quickly, and not be afraid of your decision, but learn to live with it. And that was, I think, one of the important things that I learned from the time in cardiac surgery. It was that sort of an experience.
The ability to make those difficult decisions with incomplete information, I think, is a great parallel to the world of business, as you mentioned. So you spent a number of years leading the Cleveland Clinic through an enormous period of growth, and there are probably many things you're proud of in that journey. Are there one or two that you can speak to say, when you look back at that tenure, things that you're just uniquely really proud of that you all were able to accomplish?
I think probably the thing that I'm the most proud of is the change in the culture of the organization. And I think the culture of an organization is probably the most important thing that a CEO does. And we were pretty physician-centric when I joined. And over about 5 years, we moved from being very physician-centric to being more patient-centric. We did a couple of things. We asked the question, why are we all here? Why do we get paid? Why do we have a hospital? Why do we teach, et cetera? And it became clear that there was only one reason to do that, and that was for patients. So patients first became our mantra. And then we realized that it took a team to take care of patients well. And so we renamed everybody who worked at the Cleveland Clinic, and we call everybody a caregiver. And that solidified the team and the team approach, and made sure that whether it was the bus driver or the neurosurgeon, everybody was realized why they were there. And so that, I think that's probably the thing that I'm proudest of.
I love that the patient centric as well as the shift to everyone being a caregiver, just pulling folks into the mission that we're all here for. Just amazing. Sort of the flip side of that question, when you look back, are there one or two things that you hoped you would have been able to do that you didn't get to, either maybe because of timing or any other factors? But are there one or two you point to?
Oh yeah, there are a lot of them. I think I wished I'd done things faster. Always you wish that. I think the second thing was that I had the idea that, based on my experience as a cardiac surgeon, that I used to go, and when I hear somebody doing something someplace in the world, I would go and watch them and take notes and come back, and that changed the practice of cardiac surgery at the Cleveland Clinic and subsequently across the United States. And I thought that that was such a valuable thing for me. I wanted everybody to have that experience. And so I said, look, guys, I want you to once a year take a trip someplace. We will pay for it. And you go and learn something new and bring it back to the institution, because nobody has a lock on knowledge and you need to go find it wherever you can. So I, of a couple thousand doctors, I think I could only get 50 of them to actually take me up on it. And it was extremely disappointing that I couldn't fire up the imagination of this institution. On a business side, I had 3 attempts to try and put a hospital in China. And each time it was unsuccessful for a different reason. I guess in retrospect, it may have been fortuitous. But at the time, it was pretty frustrating.
I myself have spent some time abroad practicing and observing medicine. I found it to be a very illuminating experience. During your time at the Cleveland Clinic, you helped with international expansion as well. So I'm interested to hear, as you've observed health systems abroad, are there lessons that you think the U.S. healthcare system can adopt from the way healthcare is practiced internationally? And maybe specifically in terms of the use of technology, are there particular countries or areas where you said technology is used better, or maybe processes in general that were better?
Well, first of all, I think that there's always something to be learned, and it may not necessarily be around technology. I think one of the things that we have to acknowledge in the United States is, while we don't have the best outcomes in the world, we certainly pay the most money for it. And if you look at particularly the Western European countries, they do not spend as much, but they do have better outcomes than we do. And what they're wind up doing is they are putting if you add up the money that they spend on healthcare and the money that they spend on social programs, it's about the same as the United States spends on healthcare. So what they're doing is they're proportioning their money in a different way than we are. And I think there's a lot to be learned from that. The technology, I frankly don't see any country that develops technology faster and better than the United States does. And I think a lot of that is attributable to things that come out of Silicon Valley and the entrepreneurial spirit that you find all over the United States, whether it's Nashville or New York or Boston or Austin or San Francisco.
Um, that makes sense, and I think it's just such an interesting point that maybe more spending on the social support and programs in place can actually prevent some of the downstream spend that we incur for patients who are already sick that may not have gotten that sick. So when we're thinking about the problems, or at least the opportunities to improve healthcare in the U.S., uh, a lot of people in this country have taken notice and have jumped in to try to help. And so in the last 4 years, investment in healthcare technology has skyrocketed. And in 2020 alone, which was a fantastic year for fundraising, but healthcare tech companies raised 40 billion, which was double the amount from the previous year. Now, there's a lot to be excited about here, but just to, I'm curious to hear your thoughts on all of the influx of capital and talent into healthcare wanting to solve these problems.
Well, it's very interesting. I've had conversations with multiple Wall Street types a decade ago, and I was surprised that they were not more interested in healthcare. And I think when it became 18 to 20% of the GDP, all of a sudden Wall Street and the financial world took notice of healthcare as an opportunity. And I am frankly delighted that they have, because I think that it brings all kinds of things to healthcare. It brings new vision, it brings new technology, it brings new competition, all of which I think is a tremendous positive. And some of it will work, some of it won't work, but at the end of the day, I think it challenges the status quo, and I think that's always a great thing to see. And I applaud uh, many of the efforts that are coming, and I endorse a lot of the things that are happening. We have to figure out how we are going to employ technology to make healthcare better and cheaper. And if you look at almost any revolution that there's been in the industrial revolution, it has been the fact that technology's come in and has reduced the amount of physical work that has to be done, whether it's the tractor replacing horses in the plow, and making or whether it's the assembly line making cars. But it's always technology that really changes the economics in a positive sort of way. So I am I'm thrilled with what I see happening now, and the more that the tech world gets to understand healthcare and is willing to collaborate with us, the better off I think we're all going to be.
I think that's a very powerful sort of statement there that when you look back, almost every exponential improvement in productivity came via technology innovations, and the same is likely to be true going forward. When it comes to technology innovation, it can be done within a health system, of course, by sort of hiring and building out your own team or through partnership. Uh, do you think the challenges that most healthcare systems face today, are they better off kind of working within or looking outward?
Yeah. Well, I think you have to stop and say, okay, what do we know? What's our expertise? Our expertise is looking after patients. It's not IT, and it's not development of new technologies. It's basically about looking after people. One of the strengths, I think, of the Cleveland Clinic is that we could be just clinicians. We didn't have to be lawyers, or we didn't have to be financial people, and we didn't have to be gurus and hiring people. We were just docs. And as a result of that, I think we got the experience and the concentration to be really good docs. Frankly, I think the days of the triple threat doctors is a fantasy. No longer can you be a great researcher, a great teacher, and a great clinician. It's hard enough just to be a great clinician or be a great researcher. And so I think that you need to figure out how you allow doctors to be doctors, and let people who are spending all day worrying about a technology or IT, or whether it's food services or whatever it is, incorporate them rather than trying to invent it yourself. And I'm a big proponent of partnering, and it's hard to do because there's a gap between what other expertise are and understanding our needs in healthcare delivery.
I love that. It's this idea of, let experts be experts, whether that's in practicing medicine or, building technology. When we think of where that technology innovation can be applied to, there's been a lot written about the biggest challenges facing healthcare today, and there's a number of them. Uh, if you were to help us crystallize in your mind, what do you think are the one or two biggest challenges that healthcare systems are specifically facing today?
I think there's two that are just hitting us right in the nose, particularly coming out of COVID. The first is a shortage of doctors and healthcare providers. particularly nurses. I was reading the other day that in order to meet the need for nurses, we're going to have to graduate 200,000 a year. That's impossible, and it's not just the United States; it's the whole world. The second issue is inflation has really hit the healthcare providers very hard, and the cost of goods, the cost of labor, the cost of pharmaceuticals have all soared, and the payments to the providers have not kept pace. And so we're going to have to figure out, for two reasons, how we reduce the number of people that it takes to look after somebody. For example, in a hospital, 60% of the cost of running a hospital is people. And there just aren't people. So we've got to find technologies that, one, reduce the administrative work, and two, make the clinical work more efficient, and reduce the number of people that we need to take care of people who are sick and provide care. So I think those are the two screaming needs right now and problems in healthcare delivery.
It's sort of additionally worrisome in that both of those sort of feed off each other, and so you've got shortages that result in existing labor, being compensated at a higher rate, and then you've got this negative flywheel. I want to touch on one thing you mentioned, which is sort of the administrative burden that is facing existing clinicians and staff, and a lot has been discussed around burnout. This is, maybe an unconventional question, but do you think the problem of burnout is overstated, or overemphasized, or understated? Or do we need to make a bigger deal about it?
No, I don't think it's overstated at all. I think it's real. But I mean, stop and think about what's happened over the last 40 years in healthcare. First of all, it has gone from the time when a doctor used to come to your house with his bag with all the diagnostic and treatment modalities in that black bag. And now it's not possible to practice healthcare medicine by yourself. You need expertise that's a tremendous amount of support expertise. Secondly, doctors were never checked for their quality metrics, and so now they're being measured. Um, the third thing is that there has been a explosion in knowledge, and such that guys are just overwhelmed with it. There are thousands of journals. I think there are 5,000 journals. And as I said, the total amount of knowledge doubling every 73 days. I mean, how the heck do you keep track of all that? Which is a tremendous challenge. And then finally, the fact that you now have to have the electronic medical record, and all those things have piled on, and there's people are feeling like they are overwhelmed and undersupported, and overmeasured and measured. And so the burnout is a real phenomenon, no question about it. And so we have got to figure out how we allow people to practice at the top of their license, how we reduce the manual work that they need to do, and how we get them enough support of the right kind of people that will help them manage their day-to-day practice. And, you know, um, these are challenges that I think are only going to be answered by technology.
I want to switch gears and sort of spend the last few minutes speaking about your experience at academic medical centers. I've spent nearly a decade myself at academic medicine and have loved it and loved the ability to push forward both the research and the clinical and the teaching arms of the enterprise. From your perspective, what makes academic medical centers so special? And when we think about new entrants into healthcare, the direct to consumer technology companies like Roe or Hims, when we think about Amazon, other big tech companies getting into care delivery, what makes academic medical centers so unique? And do you think there is a real competitive threat from these new entrants that AMCs are facing?
Well, first of all, I think you have to look at the tripartite mission of academic medical centers. They're expected to teach, they're expected to research, and provide great care. And most hospitals are not academic medical centers, are not expected to do but one of those, and that's provide great care. So there's a tremendous stress put on them, and I think it attracts a certain amount of certain individual who is intellectually curious, and and let's be candid with it about it, a little bit arrogant, intellectually arrogant, and that can be an issue that they think that they can do it all themselves, and may not be as willing to accept outside input as a organization that doesn't have quite as much confidence in itself. So it's a plus and it's a minus. Great things come out of academic medical centers, no question about that. The teaching and the research are and the care and in a group of very sick patients is extraordinary. But there's also with that comes the downside of not being quite as humble as you'd like to see people.
You mentioned that kind of triple mission, and many of these new entrants, the One Medicals and Amazons of the world, are sort of coming after the care delivery aspect of those three branches. Do you see technology companies and big tech starting to infringe on either the education or the research missions of academic medical centers, or do you think those two branches will sort of always belong to academic medical centers?
Well, I think that there's always going to be a role for an academic medical center to do those two aspects. But on the other hand, if you take advantage of some of the tech things that come along, it enhances those. For example, Cleveland Clinic is using HoloLens now to teach anatomy. No more cadavers. What a huge advance that is. I mean, there's the obvious advances. You can understand it better, but the side effect, and you'll laugh at this, is that it's good for the social life of medical students because they don't smell of formaldehyde anymore. So there's huge opportunities that can come from technology properly applied and accepted.
When people talk about innovation in healthcare, they often say that healthcare innovation lags other industries by about a decade. That's a very common statement. Within healthcare, do you think AMCs lag non AMCs when it comes to digital transformation, or is it the other way around? Do you see AMCs as sort of leading the charge in digital transformation in healthcare?
I'm not sure I have a very good answer for that. I've seen some for-profits, for example, move rapidly. I've seen some academic medical centers move rapidly. I think one of the things that example of is that several of the major academic medical centers in the United States decided they're going to do their own electronic medical record. And they wound up after 10 years of working on that, they decided that they'd all switch to Cerner or Epic because they couldn't keep up with it and it was impractical. So, I think sometimes the fact that you think you can do it yourself is laudable, but not necessarily practical.
You mentioned EMRs and academic medical centers. Many of them were the first to build and also adopt some of the most common industry EMRs today. As you remember that period of kind of mass adoption of electronic medical records, did anyone foresee how much time we would really be spending glued to the computers like physicians are today?
No. We made the decision in 2005 to go to Epic. And I don't think any of us realized the significance of that decision. We thought it was the right thing to do in terms of collecting the data and making it portable, and getting away from paper files that were 6 volumes thick. But I don't think any of us anticipated that what that meant. And similarly, I don't think any of us anticipated the fact that what collecting that data could do in terms of employment of AI to make decisions and to predict. Um, and to understand things in ways that we had no capability of doing prior to that. So it's been a double-edged sword. Certainly the downside is the fact that we spend way too much time looking at a screen.
It's um, it's interesting because EMRs digitize data, and they did it very well, and there's a lot of positive benefits from that. But a side effect of digitizing data is that they've created an enormous amount of work, and physicians spend the vast majority of their day in front of an EMR right now. And that's one of the things we get so excited about automation is it's sort of an antidote, an opportunity to undo the adverse effects of, in many ways, what the EMR created in terms of work queues and work lists. Have you seen that to be true? And are you as sort of bullish or optimistic on sort of the prospect of automation as a way to counteract the work that EMRs have created?
Yeah, absolutely, I am. And I think clearly we need to use the EMR. In fact, I think natural voice recognition is going to be one of those things that eventually will reduce a huge amount of the work that physicians do on the EMR, for the EMR. And I applaud the initial efforts that I've seen along those lines. But clearly, there are lots of advantages, but also an unexpected and unintended side effects. And that's true of almost any technology you stop and think about it, whether it's the internet or atomic energy. There's ups and downs, positives and negatives to it, and you have to figure out how you take advantage of the positives and manage to mitigate the negative downsides.
Yep. Just like any good medicine, there's side effects that you've got to be aware of. Um, I want to end with one sort of final question, and it's, when you think about the future of healthcare, what is the one thing that gives you the most optimism about where this country and the healthcare system is headed?
I think the potential for technology and the potential for AI is enormous. And I think it will play out over time, that we understand through genomics and uh, the use of huge data sets. We are going to understand the function of the body. We're going to be able to predict disease. We're going to be able to understand the appropriate treatments much better than we have now. And I am very excited about those opportunities. I mean, if you stop and look at, let's just compare the 1910 or 1919 pandemic that struck the world and killed millions all over the world. And with what we've just been through in the development of vaccines that happened virtually overnight, when you stop and think about it, what an incredible accomplishment. And you can't help but be excited when you see that sort of improvement in the delivery of healthcare.
Well, that's a great note to end on. Toby, thank you so much for joining. It's been an absolute pleasure to have you on the podcast, and really appreciate your time.